Hello, my name is Donna Thomas. We're here today at Catherine House to talk about a falls project that we've been implementing over the last 6 months. In this video, we'll see how the project's been implemented and realise some of the benefits for the residents, the staff, for Sirona and the wider system. So we knew in the Specialist Falls Service that we had an issue with falls and particularly calls and conveyance to hospital in our Bristol, North Somerset and South Gloucestershire area. Falls are a significant problem for the whole population. We know that if you're aged over 65, then 1 in 3 people will fall. If you're over the age of 80, then half of people over the age of 80 will fall in a 12-month period. And we know that there are significant waits for ambulance, but we also know that when people do get to the hospital within our area, 24% of them have a less than 5-hour stay in the A&E department, which starts to make you think, did they even need to go to hospital in the first place? This is really where we can start to make an impact in community services.
So we looked at the traffic light system as it already existed and supported the care homes to understand exactly what an amber response would look like, what a green response would look like. The green and the amber responses was where we identified that the razor chair could do the most benefit within the care home system. And we worked with the care homes to use that razor chair in those situations with webinar training and physical training so that they were empowered to pick the correct response at the correct time for that resident so that ambulance call-outs were reduced.
We're lucky enough to be one of the homes to receive the traffic light training from the Sirona Care Home team. And we're equally lucky enough to be one of the recipients of the razor lifting equipment. When you compare the use of razor lifting equipment to other lifting equipment we've been using in the homes, we've always been taught that you have to be 2 people to use the lifting equipment. But with Razor 2, if you have done the training and you're confident enough, and once you've done your assessment from the 4, you can go ahead and put the equipment together and assist the resident to stand up all by yourself. You come with this box now and you put them together, and suddenly from the lying position, suddenly they are sitting in an upright position.
It was just mind-blowing. I didn't know what it was. It was just these lots of metal tubes and things, and all of a sudden I was positioned and it was easy and it didn't hurt, and the relief of being upright was, well, it was just inexplainable, but there's the relief of getting up and knowing that you haven't got to go to a hospital.
So since we've implemented the traffic light system and the razor project, we've started to collect data, and it's really interesting because one of the care homes in particular did have quite a reputation for a high level of falls. So in the last 30 days, I think they've had about 52 falls. Now, before our project, they admit they would have called the ambulance because of their policies for every single fall they had. So potentially a lot of ambulance calls going into that one care home. 30 days after our implementation of project with the traffic light training and the razor, they've had no ambulance calls, they've had no conveyances to hospital. So in that one care home, we can start to see massive differences with the type of number of falls that they're having. Doing all that we can to keep place-based care and all of our efforts focus where a resident or a person lives is definitely the biggest impact that we've seen from the project. So the rate of admissions to hospital have declined. We've heard from Elizabeth the impact that it makes to the individual, and that certainly is what makes the project worthwhile. As you can see, our project has had real benefits on ambulance call and conveyance, and it's also helped improve care in the homes. Thank you very much for watching.